My name is Lisa Gerber, and I'm a student nurse at Cedar Crest College. Today I will be discussing a research article titled Spirituality and Spiritual Caring, Nurses' Perspectives and Practice in Palliative and Acute Care Environments. First, we'll start off with the significance of this research. Research related to spiritual care is significant. Within the past decade, the ideas and thoughts of spiritual care have increased dramatically. Many nurses find it difficult to provide spiritual care due to a lack of general knowledge regarding spirituality. Acute care RNs have also demonstrated low sensitivity when identifying a patient's emotional or spiritual problems. We live in a fast-paced world, and unfortunately, many nurses find it difficult to find the time for their patients. Next, we'll move on to the research questions. What we hope to accomplish by doing this research is to find some differences in spiritual caring practice by palliative care and acute care RNs. We're also looking to see if there are any correlations between spiritual perspective and spiritual caring. And lastly, we'd like to identify any barriers to spiritual caring for nurses today. The significance to nursing practice is that spiritual care is an essential component to holistic care. Just like medical treatment, spiritual care can also promote healing in the patient. Spiritual care may be difficult for nurses to perceive. And also, spiritual care development should occur early on in a nurse's education to enhance their spiritual caring practice later on in their career. Next, we'll be going through a few slides regarding the research critique and key elements. First, is this a conceptual model or a theoretical framework? As identified by the article, it is a conceptual model based off of spirituality. There are no variables or interventions within this research, and approval was obtained through the Institutional Ethics Committee, and prior to any research-related activities, participants' consent was obtained. Next, we'll look at sample characteristics. This was a non-random convenient sample. I chose convenient sample because these nurses happened to be employed at the facilities the researchers were looking to do their research. The inclusion-exclusion criteria was that the nurses either had to work in palliative care or acute care. And like said before, they also had to be employed at one of the 7 inner metropolitan health service areas. Moving on to the data collection. There were 3 components of data collection to this research. The first component was a self-completed questionnaire of socio-demographic information. The second was a spiritual perspective scale. This measured participants' view on spirituality and the impact on their life. This used a Likert scale, which was used from 1 to 6 for each of the 10 items. And lastly, the third component was the spiritual care practice questionnaire. This measured the frequency of assessment and interventions related to spiritual care and barriers to spiritual care. This also used a scale, but of 1 to 5 numbers for each of the 9 items. Research results. The researcher thought that the most important result first was the demographics. That being said, the years of experience as an RN was very significant to the research regarding the palliative care RNs. Also, the palliative care RNs were older than the acute care RNs. The mean age of palliative care was 43 years, and the mean age of acute care was 33.5 years. That's a big difference in today's world. There were differences in spiritual caring practice by palliative care and acute care RNs. The palliative care RNs had higher spiritual perspective scale scores, and they also had higher spiritual care practice questionnaire scores. This may be due in part for the environment that they are in. Palliative care deals with end of life, so spirituality is a very big factor in healing for these patients, whereas acute care is more fast-paced. A positive relationship was found for the palliative care RNs regarding the correlation between their SPF scores and their SCPQ scores. Also, there were barriers to spiritual care identified. The most common was insufficient time, and this was experienced by both the palliative care nurses and the acute care nurses. Also, the acute care nurses found that patient privacy was also a big barrier, just as big of a barrier as the insufficient time. And the least common for both of the groups was the criticism from peers. There were some limitations to the research. The acute care environments were limited, only included a target population with specific nursing specialties. So if acute care RN was not included in either general surgery, orthopedic, and medical and post-surgical environments, they were not in the study. The implications for practice here are that the identification of differences between different nursing specialties and how they relate to spiritual care can help prove to be useful for further research. The acute care RNs do need spiritual caring skills. They too deal with death, not such as palliative care where death is imminent, but more so if it's acute care, they can die and they had no spiritual care provided. Nurses may benefit from identifying barriers to providing spiritual care and overcoming these barriers. The conclusion here is that spiritual care is a current and relevant idea to nursing. Regardless of the nursing specialty, spiritual care is an important component of holistic care. It's also said that nurses may benefit from receiving additional education or information on spiritual care. And also, becoming spiritually aware of oneself can help identify aspects of life and help to become spiritually reflective to the patients. These are my references for the article. I thank you for watching my presentation, and I hope that you have gained some insight on how spiritual care can affect nursing practice. Thank you.